Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today our topic of discussion is about a common disease, that is conical corneas, which we call keratoconus, and their management by the use of contact lenses. So let's start our discussion today. This conical cornea, keratoconus, is not an infectious disease. It is not an inflammatory disease, but just there are changes happening over there in the cornea. Maybe it is because of some genetics, inheritance has been seen. Some families have more keratoconus. Some people who rub their eyes a lot because of allergies, constant rubbing, persistent problem, they are having this. So because of extensive rubbing over there, they damage the smooth surface of the cornea. And at some surface, the places where the normal sphere surface is, it becomes flatter, sometimes it becomes steeper. So all these things are happening over there. And that's how it affects and it causes the conical cornea, that we can say easily. Now the problem is that normally the image, eye makes one spot image. After light passing through the cornea, it goes and gets focused on the retina. It may be in some refractive errors when patients are using glasses. It may focus in front of the eye or back of the eye, and then we use glasses to correct it. But in keratoconus, this is not a situation. As I mentioned, the sphere is no more there. It is now an irregular, bumpy surface, we can say. Light striking at any point is going to focus in front of the retina or behind. So multiple images are being formed over there. And the patient, most important complaint is blurring of the vision. So now what is the solution for these things? Keratoconus can be managed by multiple ways. People are trying cross-linking, intracorneal rings they are putting, and advanced stages, corneal transplants are also done, and very high success rate of these things. But apart from this, contact lenses can also be used by the patients, and it gives them a great relief. The quality of the life and the quality of the vision is improved, and they can still enjoy very useful vision. So number of contact lenses are used, but the most common contact lenses used in keratoconus patients is, we talk about rigid gas permeable lenses. They are quite commonly used, and because they have transmission through them, so oxygen can pass through these rigid gas permeable lenses. So when these lenses are used on the cornea, which is irregular, which is conical, and usually this cone is in the center or lower portion usually. So in these patients, when these rigid gas permeable lenses are put, they stay over there, and just behind the lens there is tear film, and behind tear film is the cornea. So these lens make another lens between cornea and the contact lens, that we can say the tears lens that is formed. So our purpose is to great extent solved, that again the eye gets a smooth surface, near smooth surface we can say, if not a perfect one. And again, it needs a lot of time, trial by optometrists, people who are trained in these contact lens fitting. They try a lot of lenses, and then keeping so many things in consideration, the lenses are prescribed to the patients. And these are very helpful and most commonly used. But actually, these are not a perfect solution, not an ideal solution, but a useful way to control the problem and improve the vision. Rigid gas permeable lenses usually stay on, we can say, on the mid periphery, which is the healthy cornea. There they usually stay over there. They usually touch the cornea. But sometimes they can also, their conical corneas are over there. They can damage over there. They can cause epithelial defects over there. Scarring can happen. So these are potential complications which should be kept in the mind. And once epithelial damage, chances of infection as we have discussed in our early videos of contact lens infections, they can happen, but they are very minimal if proper care is done. So rigid contact gas permeable lenses is a very effective and common way to handle these situations. But sometimes a patient cannot tolerate these lenses. So the optometrists, the physicians have come with another technique that is we call piggyback. Piggyback is that technique that we put first of all soft contact lens on the cornea. And above this soft contact lens, the hard contact lens is put over there. Earlier there was problem of gas transmission, oxygen transmission, but with the new technology, this oxygen transmission problems has been solved to a great extent. So this piggyback technology using one over there is also very helpful in the patients who cannot tolerate the hard contact lenses. And because these hard contact lenses are directly over there, they move over there on the cornea, and their movement is very important. But there are certain complications which I mentioned. So piggyback is also a very useful way to handle the situation. Apart from these two types of contact lenses, that is rigid gas permeable and piggyback, there is another type, and that is scleral contact lenses. These are quite large size contact lenses, and they do not lie directly on the cornea, but in fact they touch the eye over the conjunctiva. Their diameter is quite large over there. But the thing is, in order to put these scleral contact lenses, first of all their vault has to be filled with normal saline, yes, and then they can be put over there, and they need some training over there. But these are also very effective because they are not coming in direct touch with the cornea. They are resting on the white outside conjunctival area, and there is fluid also. So to some extent they also manage dryness aspect in the contact lenses. So they are also very helpful, but they need a little bit of training. The problem with these scleral contact lenses, the large diameter contact lenses, is that because of their mass, they have a tendency to move downwards. Because of gravity, they can go down. And sometimes bubbles are formed, distortion, decentration, these things happen. But with practice and patient cooperation, these things can be managed. Otherwise, apart from this, hybrid contact lens is another option in which they have come with new technology. The center is made rigid and the periphery is of the soft contact lenses, so that to increase more compliance from the patient aspect. So these are the few contact lenses which are used by the patients in the optometry departments, and they are very effective in restoring the normal vision of the patient. That was my today's presentation about the use of contact lens as a first line of treatment in the keratoconus patients. It needs a lot of cooperation from the patients, a lot of hard work from the people who are going to give the prescription, because a lot of time is required to get to the best corrected and fit contact lens. But the results are quite encouraging. The patients are using and they are enjoying useful vision. The most important thing I tell my patients is, please do not rub your eyes. Many times they have allergic phenomena over there. Sometimes because of contact lenses, they may feel irritation. There are multiple ways to handle that situation because of the use of the lubricants. If the patient has allergies, we can use medicines like mast cell stabilizers. Many medicines can be used to control allergy. But rubbing the eye, which is already damaged, which is already sick, will add to the problems. So this thing should be, I can say, very important in the management of the keratoconus, cornical cornea, that is conservative management. If I talk, not any intervention from patient side, he must not rub his eyes and use lubricants whenever there is a problem. If some problem with the use of contact lenses, he can contact his physician to change it. So this was my today's presentation about the use of the contact lenses, different types which are being used, and their benefits. I hope my today's presentation, a brief one, will be beneficial to my respected audience, and I want to thank them for their attendance and attention. Thank you.